Stroke Pakshvatam. Is this something which we need to know? Very much. October 29th is World Stroke Day. Number 2 killer in the world is a stroke or paralysis. What happens in stroke? There is a compromised blood supply to the brain, either because there is a block or if there is a bleed in the brain. In medical terminology, we call it as a cerebrovascular accident. What happens? Sudden drop of hand or the leg of one side, along with that distorted face or inability to close eyes. These are the very much symptoms. Sudden loss of consciousness or orientation also can be a symptom of stroke. They call it be fast and be aware of the symptoms of stroke. It happens if you have uncontrolled blood pressure. It happens for a stressful person. It happens if you consume smoke or alcohol. Be fast. Face which is twisted. If you look at my face, if my sudden movement of face, that could be stroke. A is arm. If there's arm which is suddenly dropping, if you're not able to move your arm. S is a smile which is distorted. Then time is money. That's the acronym Be Fast stands for. So be aware of these symptoms and reach out to hospital before it is too late. Rather, don't let stroke happen. And what can you do for that? The most preventable way to handle stroke is blood pressure. Blood pressure, when it is uncontrolled for a longer time, that is the number one cause of stroke. Control your blood pressure before it is too late. I would tell you a couple of stories which you need to understand. Yesterday I saw this young girl who's come 23 years old with some kind of cough, and I was casually checking her and then realized her blood pressure is 160 by 100, 160/90. Again we checked it was this high. Now that is what is concerned. I don't expect a young 23 years old girl to be having high blood pressure, but there she was in front of me. Now most of us immediately responses, no, there must be some error with your checking, there must be some error in your instrument. The answer is regular monitoring of blood pressure at home is important. Family history is important. When I asked this girl, immediately she said, yes, my father and mother both are hypertensive. Parents are hypertensive, then your chance of getting hypertension is high. Parents have had a paralysis, stroke, your chance of getting stroke is very high. Take blood thinners as per advice of your own doctor. So go to your doctor before you need him, and you will never need him. Neurologists have most number of patients only because patients avoid coming to hospital or the general physicians. Who do you have to go to? The one you're popularly called as Dr. Chacha, who is your family physician. Go to him, get your BP sugar tested every now and then. Eat less of sugar, stay in stress-free life, and your stroke will never enter your life. If by any chance you've got a stroke, don't worry. S for statins, T is for tablets to control your blood pressure, R is for renal involvement to be avoided, O is for obesity, which is not good, K is for keep smiling, and E is exercise regularly. I hope this acronym of mine will keep you happy, healthy and smiling always. This October 29th on World Stroke Day, let's forward this message and give a flu shot to every stroke patient of mine, because even if he's got stroke now, I want to keep him away from hospital, and that can be done by 4 I's: investigation, immunization, insurance, and not to forget information. So join with social post and share this video, the right information to right kind of people. Reach out to me at 810-612-7475 for any doubt regarding stroke on this World Stroke Day. Let's go and hug every stroke patient. And yes, if you're watching this video, then consultation is free for you. If you want to see me at Apollo Hospital, Secunderabad, just write it on the comment section and show it to my secretary at Apollo Hospital, Secunderabad, or at Ethan's Clinic, Garden Towers, Masab Tank, or Live Life Clinic, Nanakram Goda, and you will get a free consultation, because yes, we will do everything to keep you out of hospital. Take care, God bless, goodbye, namaskar.